I am Mark Potuck. I am a tobacco treatment specialist here in the cardiopulmonary rehab department of Goshen Hospital. Before I started working here at Goshen Hospital, I had no appreciation for how much tobacco affects the cardiovascular system. There are three major things that are going on from my understanding. First of all, nicotine constricts blood vessels, and as a result, very often it increases blood pressure. A second thing that's happening is that carbon monoxide has what they call a greater affinity for hemoglobin. Carbon monoxide is kind of like a bully. It shoves the oxygen molecule off and takes its place on the hemoglobin. So all of a sudden, you are even just slightly oxygen deprived. The brain senses that, and what does it do? It causes the bone marrow to produce more red blood cells. And so now you've got more red blood cells in your blood, which thickens your blood. Now you have a narrower blood vessel with thicker blood going through, and that's a horrible combination when it comes to heart attacks. Third thing that's happening is that the inside of the arteries all over your body tend to build up plaque easier when you smoke. And that's because there are certain chemicals in cigarette smoke. They make the lining of the artery, the intima they call it, more receptive to the fats that are in your blood. So you tend to build up fatty plaque inside the artery. So again, I tell the patients we've got three things going on: the buildup of plaque on the inside, the artery being constricted, and then thicker blood going through there because of the overproduction of red blood cells, because of the oxygen deprivation. So that's significant. All those things together make it much more likely for people to have coronary artery disease. Statistics I've seen say that smokers have 2 to 3 times as much coronary artery disease as do non-smokers. So it's a tremendous burden on the cardiovascular system to smoke cigarettes.